Welcome back to the Wellness Stream at Emerge. It is my great pleasure to introduce Dr. Daniel Kraft for the future of digital health and biomedicine and where can tech take us. Daniel is the founder and chair of Exponential Medicine. He is a Stanford and Harvard trained physician, scientist, inventor, entrepreneur, and innovator. He has many years of experience in clinical practice, biomedical research, and healthcare innovation, which has also led to him being a founding faculty member of the Singularity University, which is a global learning and innovative community and collaborative platform. Daniel is going to speak about IntelliMedicine, focusing on personalized, data-driven precision medicine, and his recent initiative, the App for WHO, the World Health Organization, to address COVID-19. As well, should be mentioned that Daniel's grandparents are from Minsk, so I think that's one of the ways that we drew him into this conference, and hopefully in other ways as well. I have heard him speak before. We were at a conference together with Deepak Chopra, the sages and scientists, and he was honestly one of the best presenters and completely blew me away, and I went chasing after him and said, hey, can we talk? So here we are today. Daniel, thank you for joining us. And I now give you the stage.
Great. Thank you, Eddie. Spasiba, everybody. Wonderful to be here with you virtually. I've never quite made it to Minsk, but I hope to get there sometime soon. I'm going to share my slides here. And a real honor and pleasure to be with you today. I'm going to talk broadly about the future of health and medicine, digital health and beyond, and where technology can take us, our countries, the planet, and encourage each of you to think about how you can improve your own health and those of your friends and family and community. And as Eddie mentioned, my great-grandparents were from nearby Minsk in a town called Kletsk, I believe. I haven't been there yet either, but I hope to make it there. So I do have roots from Belarus, and I need to learn to speak Russian. So the frame of my talk is a little bit about thinking about how technology is accelerating and coming together to enable us to change and think and even disrupt healthcare in positive ways. Many fields have been changed and disrupted using AI, machine learning, mobile, from our banking to how we get our entertainment. And certainly disruption has come, especially now, through the form of the COVID-19 pandemic. And when we think about all the changes around us, you might have heard of the fourth industrial revolution. The challenge is health and medicine sometimes still seems stuck between the second and maybe the third. And we have the opportunity to really not just innovate in healthcare, but to potentially really disrupt it in positive ways, not just doing things a little bit better, but making some of the old ways completely obsolete, using some of the new tools and technologies we have today and those that are coming soon. So what's catalyzing some of this change? Is it the CEO of the company, the CTO, or certainly the COVID-19 pandemic is accelerating change, particularly in healthcare? And just as a little bit of framing, we're only in the early stages of this COVID pandemic. We're kind of in the first wave. We may have second waves and many other implications from economic to mental health. So I won't just talk about COVID, but I think it's a helpful framework to think about how we need to use technologies and new mindsets and collaborations going forward. So what is the future of health and medicine? Is it the traditional hospital and the four walls? We're starting to think about going from the hospital, whether it's in San Francisco or Minsk, from the hospital and transitioning care more to the hospital. What kind of healthcare can we do outside of the usual setting of the clinic, the emergency room, the intensive care unit? But I'm not sure about you, but when I experience healthcare, even down the street from me at Stanford Medical School where I trained, or back at Massachusetts General Hospital where I did my residency training 20 years ago, not that much often changes. When I go back to visit the ward at Mass General Hospital, it hasn't changed much in 20 years. The same alarms are beeping. We still are using fax machines. We're still using clipboards in many cases to transmit information. We still have waiting rooms full of patients in San Francisco or Boston or Minsk or anywhere. We still have the same mindsets of how we practice care. And our hospital systems, particularly now, and the waiting room model is getting stressed. We don't want sick COVID patients sitting together in a waiting area, for example. So we need to think differently to address the acute challenges of today and going forward, and get out of our old mindsets and silos and ways we have sort of traditionally architectured healthcare. So it's our challenge and opportunity to think differently, to break open the silos, not thinking about medicine based on anatomy and body parts, but how we're sort of now in a genetic age. We're super connected. We have our digital connected Internet of Things. All these things can reshape healthcare. And part of that is about our mindset. We're talking about wellness with Eddie and others. It's not just about the traditional sick care model, which we usually practice, but how do we use these to bring us more health and real health and care, not just the sick care component. Because our sick care model is really based on getting very small amounts of intermittent episodic data, usually only when you go in to see the doctor or the nurse, maybe for your annual checkup, getting a blood pressure, an EKG, maybe you have diabetes or high blood pressure, or you're writing the numbers down on a notebook and sending it by email or by fax to your doctor. So intermittent episodic data leads to our reactive sick care model. We wait to get sick for the patient to show up with a heart attack or a stroke, or I'm a cancer doctor, an oncologist with late stage cancer, or for the infectious disease or pandemic to arrive. So we need to think, instead of being intermittent and reactive, take many of the technologies that exist today to be much more continuous, with all that information flowing from our wearables, our environment, being more proactive, more personalized, and bringing that care anytime, anywhere, for arguably much lower costs, and making that available for more people. And to move the needle, not just for health and wellness and preventing disease, but to think about optimizing our health span, our general ability, and the health not of us as individuals, but of our communities, our cities, and our countries. And many of us are interested in living a long life. It's not just about years, it's the quality of life. Health span, I think, is more important than just lifespan. So all these technologies can come together to do that. So in this talk, I'm going to try and cover, what are we doing now with health and prevention and wellness? How do we think about earlier, better diagnostics? How can therapy be delivered through an app or through a 3D printed product? How do we do better discovery? How do we come together to collaborate? And how do we globalize and democratize technologies to bring healthcare and wellness to more people at lower cost? So there's a lot of thought now about the future of medicine. I was lucky to write the opening article in last year's National Geographic edition, completely focused on the future of medicine. And part of the theme is that technology is accelerating on this exponential path. I think everyone's familiar with sort of Moore's law. The power of computing in our smartphones is getting better and better and doubling almost every 18 to 24 months. That's why we've seen incredible changes in how much memory you can fit, 2 terabytes in a small little card today. How all the technologies I grew up with are now shrunk to something that's become appified and we carry in our pocket. So we've democratized and digitized many technologies. And now that brings access to health and information almost anywhere on the planet. So I want you to become exponential thinkers. Our brains are wired linearly. You think 30 steps and you'd be across my room here. But if you took 30 exponential steps, doubling, 2, 4, 8, 16, 32, by the 15th step, you're at 15, 16,000. But by the 30th step, boom, you would be at 1 billion meters. That would be 26 times around the planet. So that's the power of exponentials. That's the power of exponentials even in the setting of a COVID pandemic, when you get 1 case, 2 cases, 4 cases. Doesn't seem like much, but then a month later, you can be at millions and millions of cases. So you need to become exponential thinkers, because that's where the opportunity of stress and disruption lies. And that gives us a lens to think about reimagining health, wellness, and medicine. So let's look at some of the exponential tools we have. Clearly, the smartphone is becoming a platform for health in many interesting ways. It's really becoming medicalized, from the microphone to the sensors to the video chat capabilities. We're seeing very unique ways to engineer the phone to look inside your child's ear and diagnose an ear infection, for example. And so now all these technologies that fit on a desktop in 2000, 20 years later, are fitting in my Apple Watch. And the Apple Watch is becoming a diagnostic healthcare device. We now have computers the size of a grain of rice that have the memory and capability of my Apple Watch, and those are becoming connected in the Internet of Things, the Internet of Medical Things, now riding 5G in many parts of the world. And 5G and the Internet of Medical Things enables us to really connect the dots and data in new forms. But that creates challenges, right? We have lots of new, massive amounts of data coming at us from different forms, from wearables to medical records to our genetics to telehealth. How do we put that together in new, empowering ways? Because just having data doesn't mean that that's actually information, that's useful information that translates to actual care for you and your family or to your doctor or healthcare system. So we need to start to narrow that gap and accelerate data to knowledge to utility. I'm involved in the X Prize. We're now trying to pull those pieces together to take data and collaborations from 60 different organizations, particularly in the setting of the COVID pandemic, to think differently. How do we do better triage, testing, diagnostics, monitoring, setting up clinical infrastructure, and not just for this pandemic, but for preventing and managing future ones. Okay, so technology. Technology is great, it's exciting, but it's not a panacea. We need to align the technologies with incentives. And in many healthcare systems, I know it's different in Belarusia than here in California or in London, but oftentimes we practice that sick care side of the equation. Doctors, nurses, healthcare systems are paid to treat disease, not to do wellness and prevention. We're starting to see healthcare systems start to move to aligning paying for yoga, meditation, wellness, smoking cessation. We need to start aligning incentives. And part of that alignment is to change where healthcare happens, not just in the intensive care unit and the emergency room, but to bring healthcare from the hospital to the home, to the phone, and even inside our bodies. Or to your corner pharmacy, where more and more care can be delivered. Or through telemedicine, where you can just be on your mobile device and get your prescriptions done and have a doctor or nurse visit. We're seeing large systems like Walmart move into healthcare, even Amazon, and across Belarus and beyond, we're having pharmacies getting more engaged in day-to-day health. And part of that is enabled now by our ability to connect the dots, this idea of connected health, mobile health, digital health, taking all this information, putting it together, the data sources, and making that very individualized to you or my patients, and building apps and services on top of that that meet the individual based on their age and language and culture. And it's not just about digital, right? We have all these new amazing technologies that have accelerated: 3D printing, robotics, AI, 3D printing, blockchain, gaming, virtual reality. They're converging, they're super converging to the ability to enable us to do some incredible things and to even create entire new fields like digiceuticals or robotic surgery or artificial intelligence meeting radiology. And that gives us the opportunity to address grand challenges we have all around the world, from rising costs, aging populations, challenges with access to care, whether it's in rural California or in rural areas outside of Minsk or in rural Africa. We have challenges, again, with all the big information, how to make that useful and not just stuck on clipboards and being repeated and written down over and over again. And also our challenges with the regulatory agencies. In the United States, it's the FDA. In different parts of the world, how do the regulators bring these new technologies forward? How do the insurance companies, whether it's a state healthcare system, a socialized system like you have in Minsk, or a fee-for-service, regulate and pay for these going forward? And of course, technology is actually not the most important part of our health. It's our social determinants: access to clean water, food, vaccination, social connection, right? They're super critical. We have a epidemic actually of obesity in many parts of the world, right? Especially kids are getting obese very, very young. We can do simple things early. If you have a child when they're 6 months of age and they're starting to eat solid foods, don't give them white rice cereal, give them whole grains. It changes their microbiome in their gut and dramatically lowers their risk of obesity and diabetes later. So need to pay attention to the core physiological needs. A lot of that is human connection and basic diet and other elements. Of course, we have some new needs like Wi-Fi and battery life, of course, is the most important need these days for many of us. Okay. So how's the world changed? I mean, in the Emerge conference, you're seeing many examples of disruption. Uber used to be the perfect example of an exponential company, not inventing any technology like mobile and GPS, but putting it together to create platforms like Uber, which you've had in many parts in Minsk and Belarus. I think sometimes it's failed based on the taxi people not liking it, for example. We've even seen examples of Uber Health helping bring vaccines to patients who have trouble getting to the clinic. We're seeing Uberization of doctor visits or pharmacy. So new ways of getting what you want and when you need it through your mobile devices. And some of those drugs and devices may soon be delivered to you by drone. It's already happening in many parts of the world. So new things are coming together and disrupting the way we do things. It's disrupting the big pharma companies. One size fits all drugs won't be the future. They're going to be more tuned to your genetics. So we've all seen the world change. Many old companies have been disrupted by new ones, right? Kodak has been disrupted by digital photography. Skype disrupted the phone world. And now, obviously, Zoom is disrupting how we do our meetings and even our virtual conferences. So as you think about the future, no one wants to be the next Kodak, right? You want to be Ubering yourself before you become the next Kodak or BlackBerry. So as Eddie mentioned, I've been the chair of medicine at Singularity University since it started 11 years ago. And the goal of Singularity University is to train today's leaders and future leaders to understand these rapidly moving technologies and how we apply them to education, poverty, the environment, and healthcare. I founded a program 9 years ago called Exponential Medicine, where each year we bring together 800 people from around the world to look at what are the technologies and ideas of today and where are they coming from in the near future to help us reimagine healthcare. It's not always about new ideas. Sometimes the difficulty lies not in the new ideas, but in escaping from the old ones. So it's often about mindset, meeting the new technologies and things going forward. So if you have some time later, go to exponentialmedicine.com. There's many, 100 plus great talks about technologies and systems and new approaches to healthcare that I'm only going to touch on briefly here today. All right, let's start with health and prevention. So critical. How do we think about staying healthy, health and wellness? Most of our disease is actually based not on our genetics, but our behaviors. So poor diet, smoking, not enough exercise, not doing your yoga, stress, too much alcohol lead to most of our chronic conditions around the world. In the era of COVID, which is becoming as a pandemic, it's our behaviors. Are you staying safe? Are you staying separate from people? Are you washing your hands? Are you wearing a mask? Are you not touching your face? Those are behaviors that can protect you and your family and your community. And clearly in Belarus now, there's a big challenge with COVID. It may not be as expanded as other parts of the world, but it's definitely coming. And on this exponential, it can be twice as bad in a week and then 4 times as bad the next week. So pay attention to that. And as I've learned, there's not enough potentially proactive measures being taken there. So take it onto yourselves to be doing the best you can for your own health and those of your community. So let's think about how you can measure your behavior today. The Fitbit only launched 11 years ago. Now we have an explosion of wearable devices that can measure almost every element of your physiology and behavior. How can we use those today to help your health going forward? Well, it might start with a simple wrist sensor that can track your steps and your sleep, but it's moving into sensors that can be inside your pill, for example, or digital patches that you can wear that can track an intensive care unit level of activity. We can use small data. Let's say your grandmother just had a hip replacement or a knee surgery. When they go home, we can track, are they walking more or are they walking less? Sometimes simple, small data can be useful to help manage a patient. And where we're going to go with this is many of us are data geeks, quantified self. You have that data on your smartphone about your sleep and your steps and your exercise, but it's moving from quantified self to quantified health. Well, that's going to connect to your doctor, your nurse, your pharmacist, your yoga teacher. They'll see how you're doing with your activity. They can use that to optimize your health and wellness, also to do early diagnosis, pick up disease early rather than late, and then for therapy to manage the feedback loops and see how you're doing and adjust. So let's look at some examples of what is being digitized. Obviously, scales have been digitized. Now you can not just measure your weight, you can measure your shape, how much muscle mass you have, how much fat mass. That might be useful information in many regards. The number one cause of early death and morbidity around the world is high blood pressure. And of course, you can measure your blood pressure with a cuff, but now we're seeing ways that can be done built into your watch band, or now new radar-based versions are coming. So you don't have anything, a patch or your wristwatch will measure your blood pressure. And knowing that information can be useful. We can go to the idea of insidables, data that's collected from our contact lenses, or chips underneath our skin are coming to market that can track multiple parameters, particularly for very complicated and sick patients. We can use that data in very empowering ways. Or the idea of a trainable. Many of us don't have good posture, so now you might want to put a little sensor on your back called Upright. You put the sensor on your back, and it's like your digital mother. It reminds you, if you have it on your back, if you're slouched over too much, it'll give you a little buzz and help you sit up straight, and that can treat lower back pain and give us better posture. And there's shockables and hearables that can be in your ear and give you music, but track your heart rate. Ringables that can track your sleep, for example. Sleep is such an important part of our health. So if you do nothing else, start to pay attention to your sleep and start to optimize that. There's some simple technologies, but just getting your sleep can be super important across the spectrum. Breathables, we can start to measure our breath. Molecules in your breath can give you signs of early lung cancer, for example, or metabolic disease, or maybe even signs of COVID or the flu. And speaking of breath and masks, masks can play a very important role in preventing the spread of coronavirus. It's hard to see people's expressions on them. We're seeing advancements in this, interesting applications like this one from AO Air, where it'll be seamless and integrated, and you can see what's happening through it. Or this very interesting approach where we may have other ways of protecting ourselves in the not so distant future. Sockables, your socks can track your health. For example, diabetic patients often can't feel their feet, and there may be ways that we can measure the health of a diabetic patient. Or these technologies are getting so cheap that you can put a sensor in your underwear, 10 of these in 10 pairs of underwear to track your breathing, your respiratory rate, your steps, your heart rate. This started as a wellness platform for managing stress and helping with meditation, but now it's being used to do remote patient monitoring for patients who have asthma or maybe have COVID and other respiratory ailments to see how they're doing when they're at home, to help manage them at home or bring them in to the hospital or clinic when they need to before they get sicker. We can measure our food, how many calories it has. Does it have peanuts or something you might have an allergy to? So we can measure input and we can start to measure output. Lots of data in our food. And food is our most important medicine. Hippocrates said, let food be thy medicine, medicine be thy food. Now we can start to quantify our reaction to different foods, our metabolome, our genome, our blood sugar levels. And I think we're going to enter this future of very personalized nutrition going forward. Now, it's not just about wearables. We're in the era of invisibles. The camera on your smartphone now can pick up your heart rate and may be able to soon be able to detect your blood pressure as well. So our connected environment is going to be used to track our health. Cameras can be leveraged for older folks who want to live at home and age in place. We can track whether they're upright, are they drinking, are they dressed? So our cameras can do that. Voice can be a biomarker for our health. Voice can pick up signs of heart disease. Voice can start to pick up changes in the voice that might be related to your coronavirus. But can the cough in your microphone pick up, is it the flu, is it a cold, or is it coronavirus? Wi-Fi has been modified by engineers at MIT to pick up the vital signs of up to 10 people in a room at the same time. So we're going to have very interesting ways to monitor our health 24/7 seamlessly. So it means, for better or for worse, we're entering an age where our digital exhaust can be collected 24/7. Who owns that data? Hopefully you own that data and you can share it when you want to share it. Data is the new oil in a sense. But does your doctor want that data? Here's a cartoon. What is the doc? Just as I thought, you're generating too much data. It's not about the data, it's the actionable information. So how do we align incentives so your doctor can prescribe you a connected blood pressure cuff? And that data is integrated into their workflow instead of being overwhelmed with data and clicking on the computer. So if you're an entrepreneur, think about not just the technology, but the design. How does that get used going forward? So today I can actually take the data from my smartphone and connect it to my medical record at Stanford. The problem is my doctor there doesn't know what to do with all my, let's say, my data from my Fitbit. What does it mean? We're starting to learn, what does this digital exhaust mean in the real world? Google Health, Verily, is doing a project with more than 10,000 volunteers sharing their digital data, their weights, their blood pressure, their genomics, sharing that information so we can build better healthcare maps and build what I like to call predictalytics. So just think about the example of your modern car. Modern cars have 300 or 400 sensors in them. You don't even know about those sensors, but what you care about is when your check engine light goes on. So part of the future of medicine will be having your own personalized check engine light, taking lots of data about you and giving you proactive early warning before you have a problem with your body, the heart attack or stroke or cancer. And we're seeing examples of that. Wearables are calling emergency services if someone falls off a bike and hits their head. We're seeing examples of wearables predict who's getting the flu or not, and or platforms that are now looking to tell, kind of an Apple Watch, looking at your heart rate and other data, pick up who might have a viral illness like coronavirus. And as that integrates with our social network information, we're going to learn a lot about individuals and communities. And maybe in the future, before I meet Eddie and shake his hand or give him a hug, I'll know my risk of interacting with different individuals or when I'm in different locations. Eddie, I'm sure you're fine. Thanks. And hopefully we're starting again to crowdsource that information. Just like self-driving cars, Teslas build better maps and share those with the other Teslas and upload those to the cloud. So we need to build a hive mind around healthcare and health information. But just because we have information doesn't mean we know how to activate that. Behavior change is hard. You know you need to quit smoking and exercise more and meditate and do your yoga. Sometimes you can have a real coach. But now and more, we're seeing virtual coaches, digital coaches that can help you with everything from losing weight to managing your disease to helping coach you through mental health challenges. So we need to think about engaging each of us using digital coaches, using data so that you're engaged in your health and you can share that with your healthcare providers. The new drug is not some fancy drug or app, it's each of us engaged with our information and using that going forward. But that's not one size fits all. It needs to be designed differently. If you have a 17-year-old with type 1 diabetes and a 70-year-old, they have the same need to use insulin and manage their blood sugar, but you need to design the apps and user interfaces differently. And we might need different forms of coaches. Some of these coaches are becoming AI avatars that feel very, very real and can match the personality of the patient or the consumer using them. Voice can be a coach. There's an explosion of voice-based platforms like Amazon Echo and Google Home. And we're seeing many applications being based on these. Amazon Echo, when do I take my medicine? Or Google Home, help, I've fallen, I can't get back up. Will you be using voice? And I think the future will be as personalized health coaches that know you, your personality, can give information to you in the ways that you need it. Maybe you'll look in the mirror in the future and you won't see you of today, but you'll see you of the future. If you're working out, you're doing your exercise. Or if you keep smoking and having bad foods, what you look like, So I can see myself now and 100 donuts later. I might not have only one donut, not 100. Or if you smoke, what is going to happen to your physiology in your face before smoking and after smoking? If you see that in you, that might change your behavior. Or too much time on social media can be a challenge as well. And that gives us the ability to leverage amazing new technologies like augmented and virtual reality. These are my antique Google Glass. They have a lot of applications actually in healthcare. And the next generation of augmented reality is coming that's going to help doctors, for example, leverage complex information and bring it to them in the point of care so we can leverage information in complex ways. It's going to enable doctors and surgeons to see through the patient and do surgeries and be guided step by step. That's already coming to reality. It's giving us the ability to do education. When you can take your children and educate them through a virtual reality shirt to see through their body and see what's happening with their heart and lungs, that can change their understanding of their health from a very early age. Here's my son Leo when he was 3 wearing this shirt. He has a much better understanding of basic physiology and how to stay healthy. And of course, then there's virtual reality. Many of you have tried virtual reality. It's getting faster and cheaper. It's fun to put grandma on a roller coaster. But actually, virtual reality with these technologies like Oculus Quest and Google Cardboard can be used for therapy. For folks with burn injuries and pain, they can go into cold environments and throw snowballs. We're seeing it being used for physical therapy to get people engaged in movement after they may have had a surgery or an injury. It's being used in scary places like hospitals to put people in calm environments. They can have a procedure, but be going to the beach in some beautiful location. It's being used even in interesting ways in Eddie's world of yoga. You can go and have a virtual yoga class and be guided by a real teacher or by the avatar measuring your movements and guiding you through a course of care. It's being used in mental health. There's apps or just for mindfulness and meditation. You put on the app called Trip and you take a guided meditation course inside that environment. Or my favorite right now, I'm using this every day, is an application called Supernatural. You wake up, you put on your headset, you're now in a magical environment at the beach or on a mountaintop, and now you're engaging your body, you're doing exercise, you're being gamified. You're getting coaching as you go along. It's very engaging. I've done it now for 45 days straight and getting my heart rate up there and exercising in a very kind of fun way just in my living room. Now, for surgeons, we can use virtual reality. Now we can train a surgeon, or have one surgeon now do a surgery and have 1,000 or 5,000 people watching that surgery around the world. I was in London with my friend Shafi Ahmed doing that 4 years ago. Now virtual reality is exploding in teaching. So one doctor in Minsk can be teleporting into a surgery in San Francisco and being guided through that procedure. Or part of the future of medical education, if you're an orthopedic surgeon and you see a new case you've never seen before, you could go train for that. Just like at flight simulators, the surgeon could go into the virtual environment and now basically practice that procedure over and over again, just like a pilot would do in a flight simulator, and get that procedure right. So instead of, as I train, see one, do one, teach one, the future of healthcare education will be simulate, simulate, simulate until you get it right. All right, let's talk a little bit about diagnostics, right? So we've talked a little bit about some of the tools you can use to stay healthy, wearables to track your health and beyond. But we often do get disease. We want to pick up that disease early rather than late. It might be dementia, like Alzheimer's disease, and using new technologies like brain scans to pick up that problem 10 or 20 years early. Or even your eye tracking on video games or blood tests can predict who might get Alzheimer's disease. That's actually my brain. It comes color-coded, right? And these scanners are now getting cheaper. I had a full-body MRI done in less than an hour, and all my data came back. And using AI and machine learning, that my sort of health and wellness could be monitored at a very deep level. And no one really can necessarily afford to get a full-on MRI done every year. It's expensive, but these technologies are getting faster and cheaper. And part of the future may be you go to your corner pharmacy or clinic, and every 6 months or every 2 years, you get a full body MRI done in 10 minutes. And the results are analyzed with the help of an AI radiologist to give you those proactive results. And in reality, these MRI machines now are getting 20 times cheaper, 35 times more powerful at 10 times smaller size functions. So we can bring these MRIs in smaller and mobile ways. So lots of exponentials coming together there. And then more relevant for today is the idea of a bit of a digital doctor's bag. You don't need to go to the clinic to have diagnostics done. You can have the idea of, many of you have seen Star Trek, of a medical tricorder, single device that you have in your pocket that can give you the ability to track multiple vital signs and transmit that to your app or doctor. Or have a kit at home that might help with quarantine and monitoring a patient with coronavirus. So these are technologies that exist today. When you bundle them together with telehealth, enable you to do smart things. These bundled kits, it won't be just telemedicine on the screen, but we'll have the ability to increasingly do virtual visits. Or stethoscopes that are embedded with artificial intelligence. They can listen to your heart and have an EKG and basically give you guided relevance. Or an ultrasound device with AI that can be doing diagnostics anywhere, anytime at very low cost. Or the EKG on your watch to pick up heart problems. Or the patch that can be used in a hospital or outside a hospital to monitor patients in smarter ways. So lots of examples are here. Of course, the laboratory is a key issue. You don't need to go to the lab anymore to do labs in some cases. They're coming to our smartphones. This one is on the market already. So increasingly, we're going to bring laboratories to our home, including low-cost ways like as cheap as doing a pregnancy test to analyze for coronavirus. And that brings us to the idea of a medical selfie, where for something as common as checking your urine for a urinary tract infection, you don't want to bring that urine to the lab. You can now dip the urine dipstick in the privacy of your own home, use our exponentially better smartphone camera to take a look at that data and transmit that back to the clinician going forward. And evenly more interestingly now, we can look at the sewage. Is there signs of coronavirus in the sewage? That seems to predict more than a week earlier when actual cases will arrive. So lots of new ways of doing that. So I'm running short of time. I'm going to try and summarize some of this. Now we can bring all personal genetics in there. The cost of sequencing a genome has gotten cheaper and cheaper. You can use your genomic information to pick the right drugs that might work for you in a personalized manner, or understand diseases at the genetic level, or increasingly start to use other elements like a microbiome. The bugs that are in our gut play a very important role in our health, our brain health, our heart health, what drugs work and don't work. So we're going to see increasingly the ability to analyze your microbiome and use that powerfully going forward. Now, the trick is, how do we make sense of this? How do we connect the dots? We have our genetic information, our digital information, our clinical information. It is overwhelming to us as patients, as humans, and also to our doctors and nurses and healthcare systems. So we need help. Artificial intelligence, AI, is playing a role. I call it IA, intelligence augmentation. It's already out there in the form of apps that can look at a skin lesion and determine is that a melanoma or a mole. It's being used in radiology to help radiologists make diagnostics on CT scans and MRIs. It's already being used to detect coronavirus in some locations. It can be used in pathology. It can be used if you're getting a colonoscopy to help the colonoscopist find lesions that they may have missed otherwise using image recognition. It's being used to look at the back of your eyeball with your smartphone to understand who's at risk for heart disease or stroke. And again, that can be done at very low cost. So very interesting ways AI machine learning is coming together. And eventually we'll sort of have our own digital twin that integrates that information for you and your healthcare provider. Now, none of this is going to replace the doctor or the nurse. We need to do the blending of technology and humans together. It's not man versus machine. So, that AI is not going to replace the doctor, but the doctor using AI will replace those who don't. And in many cases, the nurse or the community health worker can use these tools to do what a regular doctor used to do and bring more care everywhere by new providers. Let me finish up in the last couple of minutes with therapy, right? Therapy is advancing in interesting ways. Maybe using convalescent plasma from folks who have recovered from COVID to treat COVID patients. Hopefully we'll have a vaccine soon for coronavirus and other diseases. Very important to get that to people who need it. But we have lots of new therapies coming forward. Gene therapy with technologies like CRISPR are enabling targeting of gene editing to cure diseases like sickle cell disease and thalassemias. We're seeing therapies blend to electroceuticals, the ability to treat things like sleep apnea and other elements. So devices under skin using electricity. What happens when your pacemaker, though, doesn't just treat your heart, but it can be hacked? We're getting hacked in terms of our medical data, but even our medical devices are getting hacked. So we need to think about new ways, not just to protect our bodies, but our healthcare systems using technologies like blockchain to layer on top of that information to keep it safe and private. Finally, we're entering an era of how we get care is shifting. Telemedicine is already here. You can talk to chatbots. Chatbots will increasingly do the first parts of care. They're exploding all around the world. Virtual care will blend with virtual reality. We'll see our virtual psychologist or mental health worker who comes to us as an avatar. We'll be prescribing apps increasingly. There's thousands of apps out there. Because there are actually so many of them, I've recently built a website called digital.health, which is a digital health formulary where you can start to find the tools that your doctor or you might want to use that match you. So check out digital.health. It's still a very early site, but a platform to help find the technologies that already exist. And finally, my favorite example of therapy now with technology is 3D printing. You can 3D print your braces or medical devices. We're seeing 3D printers help save the lives of patients in Italy where they 3D printed ventilator parts. We're seeing the ability to think about even maybe 3D printing your medication. I've been building a technology platform which enables you to replace the old pill bottle and a pile of pills with a personalized medication where you'll print your pill that matches exactly you and will have 5 or 10 medications in it instead of just one, and be a very personalized way to optimize your health and what you might need. So if you're looking for more information on that, I have a TED Talk out from about a year ago that talks about the future of the pharmacy in detail. All right, let me close with the idea that we all can contribute to the future of medicine. We can all be helping learn and reinvent everything from clinical trials for heart disease to diabetes to coronavirus. We're now in the era of digital clinical trials where we can collect our data and share it on mobile platforms. So I encourage all of you to be engaged in these sorts of platforms. We can think about the future and health of medicine as how different the world has shifted in the last 15 years. We used to drive with paper maps. Remember those? Now we drive with Google Maps and Waze and crowdsourced maps, all derived from our speed and location, shared from our mobile devices. What if we could all build better crowdsourced healthcare maps for health, diagnostics, and therapy around the world? So think of yourself not just as an organ donor or blood donor, but as a data donor going forward. And so I think the future of health, medicine, and wellness will be this convergence of many of the technologies I touched upon coming together in powerful ways. And if we have the mindset of accelerating technologies and you're not just thinking about 2020, but where technology will be in 2025 and 2030, we really can build this brave future of health and wellness, moving from reactive sick care to proactive preventative wellness and healthcare, from one size fits all to personalized, from siloed to crowdsourced. And I think that is our exponential future, where we don't need to be stuck in linear steps, but can start to take exponential ones going forward. So with that, thank you for your time and attention. Spasiba. I threw a lot at you. If you'd like a copy of my slides, just text your email only, to that phone number, and you'll get a deck that summarizes much of what I talked about. So with that, back to you, Eddie, and looking forward to some questions. Spasiba.
All right, Daniel, that was mind-blowing. As mind-blowing this time as it was the first time I heard you give that talk. Thank you so much. I'm going to give you some of the questions that came in, and I'd also like to preface it with, I appreciate the reinforcement you gave at the end there, that what this is really about is not just tech, but making our lives better and improving the quality of our lives, finding things before they arise and become problematic, and how we can be proactive about troubleshooting in advance, as well as many of the other things. And I think one of the things that happens with people who are very interested in data and measurements is, including me, is that sometimes we get lost in the measurements and forget that really what we want to do is be happy and healthy and help those around us. I appreciate that you brought that around at the end again, also to remind us why we're doing it. And I also appreciate that as a cancer doctor, as a clinician, you're taking the time right now to be with us, when you have patients to see and all that. So thank you for that too.
Sure. I mean, it's not about the data. It's about how you gather meaning for that and personalize it to you, and when it's appropriate, to connect that to the healthcare folks you work with. So we really want the technology to get out of the way. In our past model was interacting with medicine only when we got sick, and wellness maybe if you happen to go to the gym or the yoga studio. Now we can start to integrate this into our lives in more smart, personalized ways, just like when you're coaching someone doing a yoga pose. Not everyone is built the same way. You need to optimize that for them, and they may learn differently and be on a different part of their yoga and wellness journey. So part of the ability for these technologies is to democratize that anywhere. You're able now, doing virtual yoga classes, to meet hundreds or thousands of people in a single session. Virtual, digital, connected health and wellness and medicine can enable some of those same elements today. So it's about the technology enabling, not overbearing, but making it particularly useful. And again, especially when it can be proactive, to help optimize your health and wellness and prevent disease from ever happening in the first place.
So Dennis wanted to ask, we all saw the launch of Dragon Endeavor and have heard the CEO of NASA that they are planning to make a human base on the moon. Do you believe in that future in just 5 years? And what is needed from the MedTech project to help make that the reality?
Love that question. I'm a big space aficionado. You see it behind me, an Apollo 11 model signed by Buzz Aldrin. I did a lot of work with NASA. I was almost an astronaut. I made it to the very last stages of selection until my left eye acuity knocked me out. So I'm very excited about the acceleration of space exploration. It's taken a long time. 50 years ago, we were on the moon. We could have been back there before, and a lot of collaboration with the Russian space and U.S. and the International Space Station. So I think we can accelerate this, but there's a lot of challenges on the health and medical side. The moon is pretty close, but going to Mars, it's almost a 3-year trip in many cases. It takes 9 months to get there, depending. We have radiation challenges, mental health and psychological challenges. How do you keep your physiology ready to return to Earth at some point? But I think space has inspired me, and many of the technologies that got us to the moon have been helpful for doing telemedicine and beyond. So I think it's an exciting endeavor, and is going to help push technologies that impact health and medicine, and help encourage the next generation of engineers and scientists to apply their lens to solving grand challenges like getting off this planet, but having the spin-offs that help everybody on the Earth as well.
So Dennis asked several questions in a row, so I'll just take one from him. Kate wanted to know, how do we avoid health racism and unethical usage of our health data by insurance companies?
Yeah, I think there's a big challenge and issue with health and data privacy. I think in general, if we're, as I mentioned, the example of Google Maps or Waze, when we donate our data in hopefully a privacy-centric way, we can all get something back, like our traffic maps. I think if we're overbearing on the privacy side, that can limit data and our ability to learn. So I'm in cancer field. We've learned to get better and better, initially with children and then adults, by folks donating their data, entering clinical trials, but keeping that healthcare data safe and anonymized in most cases. So I think there's a blend and a risk profile that's important around privacy. So we need to use smart technologies like blockchain to enable that. It can go overboard with HIPAA and other rules that don't let data flow. I often make the bad analogy, the patient died, but their privacy was intact. They might have preferred to have lived with some of their data able to flow between hospital systems. If I'm in Minsk on a visit from San Francisco and I have a problem, I would love my data from my medical record to be able to move there seamlessly and easily. We've done that with banking. We need to figure that out for healthcare. It's called interoperability, and that's a big challenge across healthcare systems around the world. At the same time, we need to respect privacy, but also enable folks to donate their genetics or their wearable data when it makes sense.
Beautiful. Ksenia Sholina from Valenta Pharmaceuticals wanted to ask, where do you see the main hub of health tech? What kind of universities, countries, VCs, pharmaceuticals support growth of health tech innovations in digital health consumer goods better? Sorry, let me read that last part again. Support growth of health tech innovations in digital health consumer goods better. Thank you.
I mean, I think health and innovation is global. You don't need to be in Silicon Valley or in an academic university or in a pharma company. The opportunities for each of us, we all have our own pain points. Maybe it's tracking our medicines, or we have a disease like diabetes or a lung disease. We all can see pain points. Now the ability is to innovate globally and to collaborate. One of the silver linings of this pandemic is that we see amazing amounts of collaboration and data sharing and teams coming together from all around the world. We may be soon launching an X Prize for cheap COVID testing, as an example. So I think you don't need to think about only being in Silicon Valley or in any other part. In any company or organization now can come together in new ways, leveraging the technology and ways of collaborating on Zoom or platforms like this. So I would encourage you to find the pain points you have, look at the technology that exists now and can come together and collaborate, and also have the mindset of what's going to be available with $100 genome in 2 years, or what sensors and wearables and phones will be able to do, or augmented reality in 2 and 5 years. Use the future lens to solve the problems of today.
I'm going to lump these next two questions together. One from Markej, very inspiring talk. There are almost 8 billion people on this earth. How can you make sure that these innovations will reach as many people as soon as possible? And then Dennis wanted to know again, what do you think of chipping of humans? Do you think it's safe, or it's an inevitable future?
The what of humans? Chipping?
Chipping, yeah. Putting chips.
Well, I think, the power of these technologies, particularly the mobile phone, which is really a mobile medical device now, is that it can really democratize healthcare. China, which has not enough doctors in many parts of the country, has launched a couple years ago a company called Good Doctor. And I think over 250 million Chinese are using that platform, blended with artificial intelligence, telemedicine, to give them basic proactive health information, but also triage, and then can get them to medical care at an more advanced level when they need it. So we can democratize and bring and lower the barriers of health equity. I mean, there's a lot of disparity in who and where you can get healthcare. Now a rural clinic in Rwanda can have drugs and vaccines and blood delivered by a drone. And the community health worker who never graduated high school can use a mobile device or a portable ultrasound device to help do a diagnostic and maybe manage a complex case with the help of telehealth and consulting an AI or a highly trained specialist in a major city. So I think overall technology can really dramatically improve our ability to do health and wellness and public health. Again, most of the impact on health is going to be vaccines, clean water, good food, managing our environment. Global warming is going to have a major impact on human health through fires and famines and pollution. So lots of things to take into account there, but we can use technology for good. In terms of chipping people, many people are starting to opt into that. I think we're already in an era where we're blending technology into our bodies, whether it's a pacemaker or our smartphones. I don't think chips are necessarily the answer, but we'll see increasing interfaces between an API to our body that will be able to collect our data and hopefully keep that data private, but give us the ability to use it in smart, empowering, positive ways. There are many dystopian futures. AI can be used for good and for bad. You can 3D print a medical device. You can 3D print a gun. So we need to be careful about engaging the ethicists and the regulators and the policymakers to think a bit forward. Gene editing is a great example. Gene editing, CRISPR has great applications, but it was used unethically in China to make the first CRISPR baby. We need to be very forward thinking about some of the dangerous applications of this as well.
Wow. Okay, great. So we just got added 7 minutes because we have a lot of questions. Daniel, do you know anything about a project called Folding at Home?
Folding at Home, I believe, is a crowdsourced project where anyone can log into their computer and help learn how to do protein folding, for example, to help with drug discovery. There have been other crowdsourced projects where people can look at blood samples from malaria areas and help diagnose malaria. So this whole idea of Fold It and others is the power of the hive mind to help with science in a crowdsourced way. There's other groups looking at the wiring of the brain, where a grandmother in Ohio was like the biggest contributor to building maps of neurons that can build a crowdsourced map where you're blending machine learning, human ingenuity, and vision together. So I think that's an example of crowdsourcing. It's in discovery, but also even seeing crowdsourcing in diagnostics, where someone can put on social media their undiagnosed rash or medical problem, and we're seeing medical detectives from around the world help solve and find the diagnosis, and in some cases crowdsourcing the cures.
That's really very interesting. I'm curious, like, say you take your regular civilian like me, and they're for the most part basically healthy, but there's some measures that maybe I should think about looking at. I'm inundated with information, and I don't really know how to choose what I should be watching. What would you recommend for entry-level people who want to start taking a look at different health measures? What should we be looking at?
Well, I think, as you know, I mean, the most important thing for your long-term health and wellness is getting 30 minutes of exercise, maybe 3 times a week, getting your heart rate up, taking a walk. I mean, very simple stuff. Doing mindfulness, meditation, stress reduction, keeping yourself limber through yoga and beyond. Those are simple, easy things to do at home. And getting enough sleep are kind of the top 3 almost for your mental health, lowering your risk of depression and obesity, and then of course diet. So the simple things I would recommend to anybody is, there's getting fancier and fancier Apple Watches, but there's very low-cost wearables, Fitbits. You can buy them out of China for $20 equivalents. Just get some insights into your behaviors. Are you a couch potato? Are you only walking 2,000 steps a day? Are you getting only 4 hours of sleep? You can look at your heart rate variability, and see if you're potentially overstressed. Use the insights from that to help guide yourself with little nudges to maybe go to bed an hour earlier, or walk up and down the stairs, or take a walking meeting. Simple behaviors and changes that you can do day to day can make a major impact downstream, and they may give you early insights to picking up disease early. Many folks have seen on the Apple Watch or others, they find that they're sitting down but their heart rate shows 130, twice normal, and it turns out they have a heart condition, and they can go in and potentially save their lives from sort of seeing those signals. So many simple things you can do. I would start with the basics.
What, does the Apple Watch measure heart rate variability?
It can now, and there's apps that are being built on top of these platforms that give me insights into, when I wake up in the morning, a score for my sleep. How ready do I seem based on my resting heart rate? If, for example, my resting heart rate is normally when I sleep 58 or 62, and it starts to creep up to 70 or something, maybe something's going on. Or I might diagnose sleep apnea. Many folks don't realize they have sleep apnea that leads to high blood pressure and many cardiovascular issues. Many folks might have genetic risks for things like diabetes and heart disease that's exacerbated by smoking and drinking. You don't need to get your genome done to look at your family history and realize that maybe giving up habits that are unhealthy or eating a little more healthy can dramatically change not just your lifespan, but your health span. No one wants to be 120 but not able to think and drink and walk and communicate. We want to extend our health span. And again, the earlier and more proactive you are, the better, but it's never too late to start.
Super. So, and I think that one last question I'm going to ask you also is going to be about like neuroregulation. A lot of the problems that we're seeing in the world with diseases are going to be end organs that are having problems like diabetes in the pancreas or overstress and adrenal fatigue, high stress and digestive disorders. There's many things. Many of the non-communicable diseases can be seen to be balanced by things like yoga and meditation and sleeping and eating well, because they are addressing some underlying neural regulation of the nervous system and homeostasis and stuff like that. So how can you see that we can use tech for overall general neural regulation for basic longevity?
Great question. I mean, we're learning more and more about our nervous system, how we're all interconnected. We're not organ systems. We're this synthesized being that is very tied to our mental state, the mind-body connection. And I think even the work that you've done, breathing, it's, ancient technologies can now be technologized. I have an app on my watch that tells when I'm stressed and encourages me to do a minute or two of breathing. And you built an app for that as well. And we're learning that sort of regulation, your parasympathetic versus sympathetic response, if you can learn to modulate that and have dramatic effects on your heart health, your brain health, your kidneys and beyond. So I think as we learn to integrate East meets West, it's no one solution, but how we can integrate healthy lifestyle, nutrition, social connection, mindfulness that hopefully can prevent some of these diseases. And even when we do have them, can help reverse them. Our friend Dean Ornish has done a lot of work that even advanced heart disease can be partially reversed with yoga, mindfulness, more vegan type diet. So there's lots of elements, and our neuroregulation is a key part of that.
Amazing. Daniel, I'm really grateful and appreciative that you spent the time to talk to us today. It was a fabulous presentation. The Q&A was just out of this world. And thank you so much for joining Emerge. I really appreciate it.
Thank you. Thank you, everyone on the Emerge team. Stay safe out there, stay healthy, and go create the future of health and medicine for all of us.
Do you want to show your text number one more time for your slides, if you would? Just for anyone.
I will try. It's the last slide has my contact information here. You can find me at danielcraftmd.net, on Twitter at Daniel_Kraft. And if you text your phone number, just your email. So if you text your email to that number on SMS, you will get in your email a copy of most of those slides and some ways to follow up.
And what is the name of the website you created where we can take a look at the different tech stuff that's going on?
It's digital.health. That's the domain, digital.health. And if you go to exponentialmedicine.com and you look in the videos, exponentialmedicine.com/videos, there's lots of amazing thought leaders content that looks into the near and more distant future of health and medicine. So I encourage everyone to take a look at what's out there and collaborate to come up with your own innovations.
Thank you so much, Daniel.